Hi team, and welcome back to Doctor's Notes. In this video, we will focus on some key material, some key concepts on the integumentary system. The integumentary system is also known as the skin. Fun fact is that it is the largest organ in the body. Doesn't seem like a whole lot, but if you add up all the surface area that the skin takes, it does indeed become the largest organ in the body. The integumentary system is comprised of three main layers listed here. From superficial to deep, you have the epidermis, comprised of epithelial tissue. There are 4 to 5 layers that you find in the epidermis, which we'll talk about on the next slide. The second layer is the dermis. The dermis is comprised of connective tissue. There are 2 layers within the dermis. From superficial to deep, you have the papillary layer, comprised of one specific type of connective tissue, and the other is the reticular layer, known to have a different type of connective tissue. Deeper to the dermis is the hypodermis, which is synonymous and interchangeable as subcutaneous. And so these are the 3 main layers of the skin. And the epidermis and the dermis have their own sublayers. Let's focus more on the epidermis, which we previously identified as having epithelial tissue. In a different video, we talk about different types of epithelium tissue, how we describe them, and why we describe them as such. Here is a key review slide, a histology slide, if you will, that is characteristic of what you would find in the epidermis. And so the epidermis has keratinized, stratified, squamous epithelium. There are listed, or this is what is pictured here. Here's the apical side, here's the basal side. And then deeper to the basal side is going to be the dermis, where you find connective tissue. Here we have the 5 layers that are found in the epidermis. From superficial to deep, they are the stratum corneum, the stratum lucidum, the stratum granulosum, stratum spinosum, and last but not least, the stratum basale, also known as the stratum germinativum. Both are interchangeable, and so they can both be used at any time to describe that deepmost layer. In thick skin, there are 5 layers, whereas in thin skin, there are only 4. If you think about where on the body there is a tendency to develop calluses, that is typically where you'll find thick skin and all 5 layers we just talked about. Most of the skin, however, is comprised of thin skin, and in thin skin, there is one less layer. It does not have a stratum lucidum. And so thin skin, from superficial to deep, will only have a stratum corneum, a stratum granulosum, a stratum spinosum, and a stratum basale, also known as a stratum germinativum. It is really helpful to know these layers from superficial to deep or deep to superficial, because you might be asked to list the layers in a specific order. Would be really helpful to develop your own mnemonic for identifying the layers of the skin, starting with the first letter of the second word. it is important to have the word stratum at the beginning of each layer, because not including the first word, stratum, may change the meaning of your answer significantly when it comes to anatomy. Stratum, if it helps at all, means layer, and believe it's derived from a Latin word for layer. Either way, please make sure you have stratum before each specific layer of the skin to make sure you are addressing layers of the skin and not something else in the body. A mnemonic that I used when trying to remember all 5 layers of the skin is as follows. Corn lovers grow several bales. And in that example, we're using basale in that mnemonic. Know, again, that the stratum basale is also known as the stratum germinativum. There are certain structures found in the stratum germinativum that are helpful to know in terms of understanding how the epidermis stays attached to the dermis that lies underneath it. And that is the epidermal ridges, which are these protrusions right here at the base of the stratum germinativum, or at the base of the epidermis, which fits in nicely with these dermal papillae, which you find at the superior aspect, more superficial aspect of the dermis. These protrusions act as increased surface area to allow for more attachment sites to occur. However, it is a structure known as the hemidesmosomes found at the basal aspect of the epidermis or epithelium tissue that actually anchors that epidermis to the dermis. That brings us to the 2 layers of the dermis. So from superficial to deep, there's the papillary layer and the reticular layer. The papillary layer is known to have loose areolar connective tissue, which we have seen an example of in a separate video focused on connective tissue, whereas the reticular layer is known to have dense irregular connective tissue. And on a histology slide, assuming that the entire dermis is visualized, you should be able to see a difference between the papillary layer and the reticular layer, because there are different structures in each that help you differentiate between the 2 types of connective tissue found within the dermis. Also found within the two layers of the dermis are corpuscles. And corpuscles are sensory receptors. These are what are responsible for helping us feel or have the sense of touch on the skin. Meissner's corpuscles are found predominantly in the papillary layer, and they're responsible for detecting sense of touch, whereas the reticular layer has Pacinian corpuscles, which are responsible for sensing deep pressure and vibration. This slide talks about the ABCDE rule for determining whether a lesion is likely to be a form of melanoma, which is a relatively fast-spreading form of skin cancer. And this is important in the clinical setting because there are many skin lesions that tend to occur. Some are a lot more concerning than others. And the ABCDE rule helps us identify the likelihood that a skin lesion in question is melanoma, so we can make the appropriate referrals, such as a referral to a biopsy, to confirm this diagnosis and to address next steps. A stands for asymmetrical, B stands for border, and what we look for is an irregular border. C stands for color. Melanomas have fast, rapid cell division, and they have a tendency to produce a lot of melanocytes. Melanocytes are specific cells found in the stratum basale, also known as the stratum germinativum, that are responsible for pigmentation. And so when you have fast-growing melanocytes, then there is a higher chance that there will be varying degrees of pigmentation within the same said lesion. D stands for diameter, and the big number here is 6 millimeters. Any lesion that is greater than 6 millimeters in diameter is more likely to be a melanoma than smaller moles. Now, in a clinical setting, not all rules have to be checkmarked in order for us to refer to a biopsy. There is a considerable amount of experience and clinical judgment and rationale and decision making that is involved in making the appropriate referral. Generally, the more of these factors we check mark, the more likely something is a melanoma, and we want to make the appropriate referrals right away. However, sometimes maybe only 1 or 2 of these rules apply, and so what we then recommend is close monitoring, waiting and seeing, and maybe referring a follow-up in about 3 months' time. The patient returns in 3 months and we notice that the skin lesion has changed and/or gotten bigger. That is a big red flag, because most benign lesions like moles do not grow that fast. And so that's why E stands for enlarging and is the 5th and final rule when it comes to the ABCDE rule for determining the likelihood that a skin lesion is a melanoma. I hope you found this video to be very helpful in helping you understand key concepts in understanding the skin and why this may be really important in a clinical setting. Thank you all for spending the last several minutes with me, and I look forward to seeing you in the next video.